Understanding Mpox, the urgency behind whose global emergency declaration. The World Health Organization, WHO, has officially declared Mpox a global health emergency, responding to the growing number of cases, particularly in Africa. This virus, part of the same family as smallpox, generally causes milder symptoms such as fever, chills, and body aches. In more severe cases, people may develop noticeable lesions on the face, hands, chest, and genitals. Mpox, previously known as monkeypox, was first identified in 1958 during outbreaks of a pox-like illness in monkeys. However, the name was recently changed as it's believed the virus likely originated from rodents rather than monkeys. This week, WHO Director General Dr. Tedros Adhanom Ghebreyesus expressed grave concerns over the emergence and spread of a new Mpox variant, stating, "It's evident that a coordinated international effort is crucial to halt these outbreaks and save lives." The virus has crossed international borders, with over 14,000 cases and 524 deaths reported in Africa alone this year. The Democratic Republic of Congo has been particularly hard hit, accounting for over 96% of the fatalities. This marks the second time in 2 years that the WHO has issued a strong warning about this virus, which first drew global attention in 2022. The WHO's emergency declaration aims to prompt donor agencies and countries to take action. However, previous global responses have been mixed. Dr. Jean Kazier, Director General of Africa CDC, emphasized that the declaration was intended to mobilize our institutions, collective will, and resources to act swiftly and decisively. He also appealed for international assistance, highlighting that the growing number of cases in Africa has largely been overlooked. "It's clear that current control strategies are failing, and there's an urgent need for more resources," said Professor Michael Marks from the London School of Hygiene and Tropical Medicine. He added that if declaring a global emergency is what's needed to unlock these resources, then it's justified. Historically, most human cases of Mpox were recorded among people in Central and West Africa who had close contact with infected animals. The first Mpox emergency was declared by the WHO in 2022 when the virus was found to be spreading through sexual contact, leading to outbreaks in over 70 countries that had never reported cases before. Although case numbers dropped significantly after an intensive vaccination campaign, the virus has remained endemic in certain parts of Africa where vaccines could not be delivered. This year has seen a sharp increase in cases, already surpassing last year's numbers. The Africa CDC reported that Mpox has been detected in at least 13 African countries, with a 160% rise in cases and a 19% increase in deaths compared to the same period last year. Earlier this year, scientists identified a new form of Mpox in a mining town in Congo. This variant, which may be more easily transmissible, can have a fatality rate of up to 10%. Unlike previous outbreaks where lesions were mostly visible on the chest, hands, and feet, this new variant causes milder symptoms with lesions appearing on the genitals, making it harder to detect and potentially leading to further spread before individuals realize they are infected. During the global outbreak in 2022, the majority of cases were among gay and bisexual men, with the virus primarily spreading through close contact, including sexual activity. In contrast, recent patterns in Africa show that children under 15 now represent over 70% of the cases and 85% of deaths in Congo. Ahead of the emergency meeting, Dr. Tedros highlighted the diverse nature of the outbreaks, stating that officials are managing several different outbreaks in various countries, each with unique transmission modes and risk levels. He emphasized that stopping these outbreaks requires a tailored and comprehensive response. For the first time, Mpox has also been detected in 4 East African countries, Burundi, Kenya, Rwanda, and Uganda, with all cases linked to the ongoing epidemic in Congo. According to Greg Gonzalez, a Yale School of Public Health epidemiologist and WHO advisor on Mpox, this outbreak has been simmering and spreading for over a year now, and it's crucial that we act quickly to provide the necessary tools and support to the DRC. The WHO has released $1.45 million from its emergency fund to support surveillance, preparedness, and response activities. However, they estimate that up to $15 million will be needed to effectively scale up these efforts and contain the virus's spread.